Yeah.
I have such joy
Yeah.
in my life. My faith is a very important part of who I am.
Absolutely.
And so I believe we're here for a purpose. And ultimately in the end, we're going to win, right? So I'm not worried where my mom and my sister are. I just miss them, right?
Hmm.
But once I realized that my body did not have to feel exhausted, I didn't have to be so cranky. My joints, I didn't wake up with headaches Once I realized that what I put in my mouth was the key,
That's right.
I became abundantly thrilled with life.
Mm.
Except ticked off I didn't hear about it 30 years sooner.
Welcome to the Protecting Your Nest podcast. In Bronnie Ware's book, The Top 5 Regrets of Dying, the people she interviewed shared what they regretted at the end of their lives. And the fifth regret was that they wished they had let themselves be happier. Of the 5 regrets, this one may be the most surprising. And what she found in her research was that happiness is a choice. And if we can only get stuck in old patterns and habits that no longer serve us, stuck in the comfort of what's familiar, stuck in the fears of change, and most importantly, content with the mediocrity of our current state. In order to find a path to a happier life, sometimes we need examples shared by others who have found a path to a happier life. A path that has not only made their lives happier, but by being an example of the lives of those around us. Today, I wanted to introduce you to someone who uses humor and easy to understand examples to help others on the journey to informed self-care. Someone whose story I hope will inspire you to be a little happier than you may be today. Today's guest is Cindy Davis Mikolajczyk, and you'll correct me if I didn't spell it right, Cindy.
That's a
Of
hard
the
one.
That's quite right. It's a tough one. Of the Ask Nurse Cindy YouTube channel, Nurse Cindy has been a registered nurse for over 40 years and over those years has struggled with weight herself. The struggle has been much easier with the help of the ketogenic eating pattern. And with her success, she now uses her YouTube channel and opportunities to speak at conferences and elsewhere to help others discover the freedom that occurs when we fuel our body with low carb, high fat, and moderate protein. Cindy, we had a ball at the Low Carb Cruise, which is why I wanted you to come to this episode of Protecting Your Nest. So I welcome you to the podcast.
Well, thank you so much, Dr. Hampton. It's just a joy to be with you.
Yes, for sure. And you really brought the energy to the Low Carb Cruise. And I remember, you may remember, there was a time when we were at the casino and you sat right behind us and we heard all of this ruckus.
Oh,
This
no, I did not. Did I know you were there? I might have behaved better.
That's right, I know. And then we look back and I'm thinking she must have hit the jackpot. And I think that one win was like $1.26. I'm like, wait a minute.
That was 126 credits. That was a
Right.
lot.
That's right. That's what it was. So you really you tickled me. And again, it made the experience so much fun when people you respect and love and they're just right next to you being themselves. And so I really appreciate that. And we'll talk a little bit more about the fun we had, but I really wanted to just bring that energy to this episode. And I'm going to start by asking you a little bit about your profession. Obviously, you're a nurse, but I think you spent some time in the ICU and now you're doing wound care. So I want to get a sense of why ICU, why wound care, and any stories about either that would intrigue my audience.
Wow. Well, I've been a nurse for 45 years. I passed my boards in 1978. So
Wow.
I've been a long time nurse and I've done a lot of different things. When I got out of nursing school, I worked for a year in what we call a med surg floor, medical surgical, someone that's either in with a medical problem or surgery. And I'd always been intrigued with working in the operating room. I liked that rotation during
Yeah.
nursing school. So after a year of med surg, I went into the OR. I loved it. I worked with some amazing reconstructive plastic surgeons where they take complex wounds, not the cosmetic type, this is reconstruction, and they would help reconstruct a tremendous deficit in the patient's body. And then we moved to West Virginia, and I went from a very progressive OR to a very small rural hospital. and I was quite bored compared to what I used to do. My husband said, well, you've always said you should never be bored in nursing. There's always something different. So I worked recovery room, which we call PACU, post anesthesia care unit. And then my daughter Rachel was three years old. I just had my second daughter Lauren, and Rachel came down with the chicken pox, and I mean a severe case in her ears, up her nares, just horrible case. So she got over that. I went back to work once I could send her back to daycare, and she became type 1 diabetic. She had an autoimmune response to the viral infection that was so severe. And I had a 37-month-old and a 3-month-old. The 37-month-old was type 1, and that was back in 85. So there weren't CGMs. There weren't. So I had to get a job that would allow me to work night shift. And ICU had an opening. And so I don't know if you know the jokes about night shift in ICU, but we are a weird group.
Yes, you are. You can be.
Well, we're very tribal because we have to watch out for each other and for our patients. There's not the resources available in most hospitals at night that there are during the day. So I did ICU for 6 years. And if I look back now I do wound care, and I do things where we use medical devices to help wounds heal faster. And I was reminiscing over my career in preparation for this, just thinking through. And I thought, every time I've engaged, other than that first year, it's been where I'm allowed to use technology to intervene and help a patient get better. And so in the OR, it was one patient at a time. They'd come in, you'd help the doctor, they'd go. In post-anesthesia care recovery room, it might be 2 patients or 3 that you'd be watching because they were recovering. They were coming out from anesthesia, you had to watch their airway. In ICU, it was 1 or 2 patients, never more than that, because they're so critically ill, because you could only, there's so many things you're doing. And I thought, wow, isn't that interesting that I'm now in medical device, and I've always been drawn to the technology and the intervention that allows us to help people. Now I don't do one-on-one. I teach. And so I'm leaving for a conference on Sunday, and I might speak to a room of 100 doctors or 200 nurses, or maybe it's 15. And I can pass or transfer that knowledge that instead of helping 1 or 2 patients per shift, I can hopefully engage their brain that, here's a resource I hadn't quite thought of. And it's just what drew me to it. I've always been, I want to help. Sometimes it drives my husband crazy. Let me help you with that. But I love to help people and was always fascinated by blood.
Yeah.
I'd cut myself. I'd say, oh, look at that. That's really
right. And you're
anyway,
fascinated.
So that's in a nutshell. I love to help.
Yeah.
And I think that's one of the reasons that I am so honored to be here. Because if I can help shed a little bit of light on the struggles I went through as a nurse and the mother of a type 1.
That's right.
But I didn't find low carb till I was 59.
No, I know.
8 years ago. And I just was filled with such incredible aha. And then anyone here on the parent, especially us moms, we have this mother guilt, like, oh my God, what have I been doing to Rachel? Because we didn't know what we didn't.
That's right. Didn't know. And I'm
so
going to circle back.
Me. I still work. I still, I had an appointment. The company I work for, Solventum, was just spun off from 3M. So 3M Healthcare is now Solventum. And so they transitioned all our 401k. And I was meeting with this financial dude that, he's like, well, I see you're 67. I was like, yes. He goes, when do you plan on retiring? I said, well, when I stop having fun.
Ooh, I love that.
Because before FDR and Social Security was created during the Depression, there was no retirement. Right. We had purpose and we worked. And I love that 5th regret. I don't love that is a regret, that so many of us view life as a series of tasks. And in many ways it is. But it's the half full, half empty. I don't know if you have heard of Zig Ziglar. Very famous.
Love him.
So he said, many times we need a checkup from the neck up. Otherwise, we get hardening of the attitudes. And that leads to stinking thinking.
That's right.
That
And
whole thing about mindset,
I agree.
about happiness is a choice. I have philosophically and intrinsically felt that. I was
Mhm.
born an optimist. You know, we have different personality types.
That's right.
I have always been optimistic, but I was hit pretty hard a couple of years ago. So if any of your viewers go back to my YouTube channel or ask Nurse Cindy on my Facebook page, you'll see there was an abrupt stop about 3 years ago of any type of regularity. And that's when my mom and my sister, my two best friends in the world, passed away within a year and a half of each other. And my grieving was, when you lose two family members, it isn't just twice the grief. There's a multiplier there. And
Mm.
I think the only thing I did well, Dr. Hampton, during that whole horror, I finally got some therapy, um, was I didn't go back to eating carbs. Somewhere deep inside, I knew that if I went back to that, game over. I
Game
would
over.
just, I would just, because for me, carb addiction is real. Some people have differing feelings about that. I can guarantee you, I was never addicted to broccoli. Never. There's no 12-step group for broccoli
No.
or even tomatoes, right?
No.
But when I was in the 60s and 70s, my earliest memory, by the way, for the audience, is of always being, let me say this again, always being the heaviest kid in my class.
Always.
Always, or the neighborhood, always. I have zero recollection of ever being passed over visually because I was just normal. I was always the one that, and back then, I mean, childhood obesity is unfortunately much more common, but back then it was very uncommon. If you look back at the old movies from the 40s, 50s, 60s, even early 70s, the chubby kid was the one that was made fun of, or that was the clown. And there were two pathways: introvert or be the clown. So I'm an optimist and I'm outgoing. I chose the clown, the helper. And I tried every available classic calories in, you're eating too much, eat less, move more, Weight Watchers, Jenny, you name it, cabbage soup diet, the fasting, I mean, juicing, not fasting, juicing. Um, and here I am. I'm a nurse. I'm working with critically ill patients and I weighed 305 pounds. I had to get special scrubs made back then because
Right.
I've been working in wound care for 32 years. So you think back, I had to go into the
Mm.
men's section and get the men's extra, extra large, which meant
Mhm.
it had the pockets and places that women scrub. Anyway, long
Mhm.
story. And when I I would try, Dr. Hampton, so hard, but over time, I was never. It's so weird that you can be a nurse and still be so unaware and have
Mhm.
a type 1 diabetic daughter. And I would do the Weight Watchers points bars because they were actually, I could have 25 of those a day.
Right.
And still be within my points range
Right.
because I was searching, constantly searching for that hit of sugar, because when I put in my mouth, once I swallow it, my body takes over. I can choose what goes in my mouth. That's my voluntary choice. But once I swallow it, the body takes over.
Mm.
And I would get this sharp sugar spike, and that's that rush, ooh, that was awesome. And then my body would, especially when I was younger and I wasn't so insulin resistant, my body would say, holy moly, and it would release insulin and it would say, grab that glucose, and it would say, time to go. And then I'd feel that downwards. And so I was on this roller coaster
Mhm.
of seeking food, getting that rush, and it dropping down. And so any diet that didn't restrict what caused that spike, I was destined to feel inadequate. I was
Mhm.
destined to feel like a failure. And then it got to the point I was like, why try? Why bother?
Mhm.
It's not worth it. And then I found low carb. And I am telling you, I've been set free.
Yeah.
I have such joy
Yeah.
in my life. I've always, my faith is a very important part of who I am.
Absolutely.
And so I believe we're here for a purpose. And ultimately in the end, we're going to win, right? So I'm not worried where my mom and my sister are. I just miss them, right? But once I realized that my body did not have to feel exhausted, I didn't have to be so cranky. My joints, I didn't wake up with headaches once I realized that what I put in my mouth was the key.
That's right.
I became abundantly thrilled with life, except ticked off. I didn't hear about it 30 years sooner.
I know. I
I
know.
mean, the years wasted, right?
I know.
And my
It's just,
daughter Rachel, oh gosh, that mom guilt but once I understood it and explained it to her and her husband, she's, as you know, she's on the CGM. She has
that's
the
right.
insulin pump now. We didn't have that, but she'll go into her endocrinologist and they'll say, "You're taking how? What's your basal rates? What?"
Yeah.
She takes solo. So I have been all over the board. That's a crazy answer to one question about
But
my
you know
years.
what? It's inspiring, and I'll circle back on your daughter because you did talk to my wife who has type 1, and I want to just speak to that briefly. But in terms of all you said, the most important for me, and hopefully my audience is, you control what you put in your mouth, and then the body takes over. I think that's an important message because particularly for type 1s, because
Oh yeah.
the roller coaster for a type 1 is an impossible roller coaster to control if you allow those spikes, which you'll never match with the insulin. You can try to match it, and you just won't. It's impossible because it's hard to figure out what you put in your body exactly in terms of carbs. But most importantly, it's hard to then know how my stress is going to impact me. It's
Yes.
gonna,
Oh my
and then you have
goodness.
to add, am I exercising, and all these other factors. Um, and I just think that's important. So let's with all you've said, there was a lot of parts of it that
Sorry.
were kind of down, but yet you're this optimistic person. So I remember when I first met you, we were traveling from the airport to the hotel in the little small van, and I get on the van, and all of this energy and excitement sitting close to us, and that energy again affects everybody around you. So um, and you were the person, and we talked about this before we started, that got
Yeah.
most of the people up at one of our events where we were asked to dance and participate. And you literally came up to us and grabbed me or my wife. And next thing you know, we're dancing on the floor. But so you bring this energy. So my question is, were you always this person or did you become this person?
That's a really, really good question. I think it was buried under mounds of fat,
Mm.
guilt, shame, embarrassment, and it was always there at some level. My girls and I were talking the other day. We do the three-way, phone calls or FaceTimes, and they're like, Mom, we were just talking the other day that when we were growing up, you always made things fun.
Mm.
You always made things fun. And that's their memory, what they don't remember is how much I was limited. I
Mm.
had to put a towel across my abdomen when I drove because the steering wheel rubbed.
Wow.
I had to always sit in a restaurant at a table. I could not sit in a booth because I wouldn't fit. Going to a movie theater, they didn't have these big recliners at the time was hard. So I think in many ways it was there, but I'm not encumbered.
Mm.
I'm not encumbered getting the strange looks,
Mhm.
the condescending looks. My husband once and only once in his life said this to me a couple of years ago because I think he's almost forgotten the size I was when we married. It's our second marriage, so we've been married 16 years. And he said, after we'd passed someone, he said, "I don't understand why she doesn't care." And I really came to a screeching halt. And I spun around and I said, "Let me guarantee you, she thinks about it every moment of every day. She
Mm.
thinks about it when she gets the looks, when she can only buy clothes that fit versus what looks good, because nothing looks good It's just this fits, so I'm going to buy it. And so back to your question about the joy, um, it has been released.
Mm-hmm.
You know,
Yeah.
what was that movie, the Pirates of the Caribbean? Release the Kraken.
Right.
So I love engaging with people and getting them to realize they can enjoy movement in life. So this cruise, of course, not the whole cruise ship, but
Mm-hmm.
we were with, what do you think, 350, 400?
About 350. Yep.
And many of us have lived a life of restriction,
Mm,
inactivity, and feeling comfortable dancing. In not wanting to be stared at because we're the only heavy person on the dance floor.
that's right.
And so I don't know if you noticed, but as I was going around looking at, because I was just determined we were going to have fun. There were a
That's
few
right.
ladies on the dance floor when I walked in,
Right. Right.
and there was great DJ, right? And I'm like, I'm looking around and there's toes tapping and some people are doing this.
That's
I'm like,
right.
all right, let's get this let's get this party started, because once you realize that really no one's looking at you,
That's right.
just
Oh
enjoy
yeah.
yourself. Oh my gosh. And even if they are, I saw a few videos Debbie took of me shaking it and I was like, oh no. That's out there for the world to see. But
That's right.
it is such a joy to wake up in the morning without,
Yeah.
I mean, it's very rare if I wake up
That's
with a
right.
headache. I would wake up with my head drawn back with just the tension and this massive band. My joints ached all the time. I had no energy. 2 years ago, my husband asked me, he said, Cindy, you're the hardest person to buy for. He says, your
Mm,
birthday's coming up. What do you want?
right.
He said, just tell me what you want. I said, honestly? And he said, inside his brain, he's thinking, oh no, here it comes, a big necklace, something. I said, I want my own lawnmower. He's like, excuse me?
That is funny.
Because we had somebody, we don't have a huge yard. It's a corner lot, but it's not huge.
Hmm.
And we had somebody doing the lawn. I believe that one of the changes in my life is I try to functionally remain active. And what that means to me, because I see a lot of patients in nursing homes, younger than me.
Hmm.
I see a lot of patients in assisted living. And in the assisted living arena, particularly, it's because they cannot do their own self care. They
Right.
can't really toilet themselves well, get on and off the toilet. If they drop something on the floor, they may not have enough balance and they'll fall over and can't get up. And so, as I've been looking at longevity, because I finally feel like I'm going to have a robust, I want to be that sassy, or I already am the sassy grandma. I'm going to be a great grandma next month. I want to be that sassy lady that you see walking through, down the street
Right.
with her little purse, and she's just like, oh, but one of the things I try to do, many of us don't like going to the gym at certain phases of our life, but we can do things that are functionally important to our ability to care. And he said, you want your own lawnmower. I said, not a pull thing, not the gas and the carburetor and the air filter. I want a battery powered lawnmower.
Mm,
And he's
nice.
like, uh-huh. Anyway, we got me that. And we got me my own little battery weed whacker. And so depending on how frequently it needs to be mowed, I'm out there and I don't use the self-propelled thing. I push that puppy up and down and I do the map my
Right.
walk.
That's right.
It's like a mile and a half by the time you go.
Nice. Right.
Anyway, so I encourage all of us as we seek, and that's why I talk about informed self-care.
Hmm.
Nobody's going to come rescue you. No GLP-1, no bariatric surgery. It might be a tool you need. It might be a tool you need depending on where you're at and how long you've been struggling. But no one's going to come and magically give you this. Podcast will not change your life unless you act on the information.
That's right. Got to do it.
And you got to do it. So I'm sitting here and my here's
That's
I keep these, and if I'm on a call and I don't have to be on camera like I am
right.
now, I keep different size weights right next to me.
That's right.
And I do different functional movements because I need to be able to reach. I
Right.
need to be able to lift my groceries out of the back of my car
That's
if
right.
I want to stay independent.
That's
And
right.
dang, I'm pretty independent.
I love it. I love
So
all of it.
yeah, so that's the type of stuff that but I think feeling better, a lot of the inflammation and a lot of the excess weight I mean, from my highest ever, I'm down 150 pounds.
150 from your
From where I
height.
started keto at
That's a big
240
number.
years
Wow.
ago, I'm down 94.
Wow.
So when you think of, I'm going to be at checking in luggage tomorrow, and I'll lift that up on that scale. And I don't, if I'm going to check luggage, I'm going to put whatever I might possibly need. I might,
Mhm.
somebody was making fun of how much luggage I had on the cruise. I'm like, you never know. You never know what you might need. But anyway, I'll lift that up and she'll say 42 pounds.
Mm,
And I'll look at that and I'll think, I used to carry 4.5 of those on my body.
mm.
Why is there not reason for joy, for celebrating, for pushing the envelope, for wanting others to find that freedom? Um, yeah, so I think part of it's a natural optimism, and part of it is when you've
Mhm.
been set free,
Mm.
you're like,
I
oh, I,
I I
I got a
love
lot
it.
of living to make up for.
It's amazing. Our lives are different because of these changes we've made. It didn't just affect me and my irritable bowel. It didn't just affect my wife and her type 1 diabetes, but my kids are way more productive as they enjoy keto lifestyle. I'm more of a carnivore, and I tell you, happiness is much easier to achieve when your family is happy. And I know
Yes.
your family has benefited. You've already mentioned your daughter. My wife has type 1 diabetes. And when she talked to you, I know you guys had a conversation around your daughter and type 1 diabetes. And I think it's important that clinicians like me and you understand what it's like to
Mm.
have a life with type 1 or type 2 diabetes. And so she felt a sense of comfort talking to you because she felt like you understood her life
Yes.
through the lens of your daughter. And so I'm curious, like, I know you just shared a lot about what your life was like, and a towel across your abdomen when you're driving. Me, who does that? Um, um,
Otherwise, I'd have dirt stripe across my
I remember
sweater jacket. You
of
know?
course, it's that's crazy, having to make sure you don't
Yeah.
sit at a booth, dealing with those strange looks. So when you think about I think about my wife and what her life is like. She has to manage. We have to say,
Yes.
"Okay, we're gonna take a walk. Where are your sugars?" "Oh, we're about to eat this. Where are your sugars?" Um,
Yes.
and so all of these things that you have to worry about. In fact, I don't know if you were, on the bus when we had to turn the bus around.
Yes, I was. I
Yes, I
was.
figured you
Yes.
were. So for the audience, we're leaving, the hotel. We spent the night at the hotel so we can have a meet and greet the night before, and of course, everybody will be on time. And so the next day, we're on our way to the Royal Caribbean cruise.
Mhm.
And thankfully, maybe in fact, you could still see the hotel by the time my wife
Yes.
realized, because she has type 1, she left her insulin in the refrigerator at the hotel. Thankfully, we weren't far away, so I had to turn the bus all the way around and and she was embarrassed, but thankfully, a bus full of people who get
Yes.
it, right?
Yes.
And,
Yes.
and I'm just so she just so it's those moments you realize people who have type 1 and some people with type 2 take insulin. You can't get on a cruise ship without insulin.
Oh, no. No,
That would be
it's not like, "Oh, I left my favorite hairbrush at the hotel."
right.
It's like, I'm just
You
make
could
it's like I will die or be in a coma if I don't
That's
go back
right.
and get that.
And
And I'm very proud of you for standing up, and I was literally almost right across, and
yeah,
somebody said, "What's he doing?" And I think your wife said, "I left my insulin in the
I know.
refrigerator." And
I
I and
know.
I went into immediate head swivel, and I was like, "Are you type 1? Do you have is it a pump?" And she was like, "Yeah." I said, "I'm sorry you're going through that, but my daughter, she's 42
Yeah, and
now."
that's kinda what kinda connected you guys in that moment. Yeah, I didn't even realize it was in that moment,
Yeah.
and so I thank you for that, and it was kinda funny because once she and it didn't take her long at all to go up and get it. Thankfully, it was still there,
Yes, it was great. Oh, thank goodness, right.
and she made a declaration I thought was funny. She said, "Well, She said dinner will be on me on the cruise, and she
Of course, it was.
it's like, okay, well, thanks for paying for something that's going to be paid for already. But because she's crazy too, she's a lot of fun. So
Oh
just through
gosh,
anything you could share about having a daughter
yeah,
with type 1 diabetes, anything that you can think about that similar to what
yeah.
we've discussed that people need to hear.
It is truly has to be at the forefront of her mind all the time.
Hmm.
We didn't realize that back in the mid 80s. And it wasn't up until CGM started coming out, continuous glucose monitor, because you would have to do a finger prick every
Right.
day.
That's
And her
right.
poor little fingers, especially when she was 5 and 6, were meat. They were just
Oh,
meatloaf all the
that's right.
time.
Yeah.
And so I think if I could look at someone being, oh, well, here's my example. A real life, my daughter, my other daughter, Lauren, is not type 1, but there can be some sort of familial genetic tendency for
Hmm.
type 1 autoimmune type thing.
Hmm.
In December 29th, my daughter Lauren and her family of 4 had had the flu, just not COVID, but just that respiratory flu where they were achy and hack cough. And she had mentioned to me when I was checking in on her that her son Joshua, who's 11, seemed to be hit harder and that he just wasn't doing well and was losing weight. And
Hmm.
one morning, on the 29th, her husband walked in to check on him because he hadn't gotten out of bed and found him with this deep, irregular breathing that now
Hmm.
we know is Kussmaul breathing. It's when you're so acidotic metabolically, the body is trying to blow off all this carbon
That's right.
dioxide
That's
to
right.
not, because diabetic ketoacidosis is a real thing if you're type 1. Anyway,
That's right.
he picks him up, puts him in the truck, and screams down the street to the hospital, and his blood sugar was 782.
Mm.
So when she called me, I'm immediately hysterical because A, it's my grandson. Anyway, make long story short, I was in Idaho Falls and spent New Year's Eve holding his hand in ICU
Mm.
as they got that ketoacidosis back under control. And he was finally able to respond and acknowledge. So that's the reality of how type 1 can start in children. It's abrupt. They have
Mhm.
increased thirst because all that sugar is trapped in their bloodstream. They have increased urination because the body's trying to pee out the sugar. And they have weight loss because all the energy's stuck in the bloodstream.
Right.
And so they lose weight. And his recovery now, compared to what I went through with Rachel, is nothing short of game changing. Because now he's on his CGM, he's on his Dexcom, he's got the loop starting to, the algorithm starting to, but it does not change that every single moment of every single day,
Mm.
you're quite aware that stress, lack of sleep, how
That's
much
right.
activity I have, what have I eaten, is that carb count accurate? Is Did the manufacturer put the right number of is that apple a little sweeter than the other type of apple?
Mm.
And it is such a overarching weight on them and the family, but he has the most amazing future ahead of him because of what's going on. And we're very
Mhm.
fortunate that Rachel, even with all the things that I or we as society and still unfortunately much of medical community thinks just give them insulin. It's going to just eat what you want, just cover it with insulin.
Mhm.
Well, you can cover it and you can get the blood sugar down, but that sugar just gets stored because it's
That's right.
energy.
That's right.
And one of the things that we didn't realize, and I talked about this on the cruise, is that sugar is tricky because it's so sticky
Mhm.
and it will, in diabetics and non-diabetics alike, that sugar molecule will stick to their face if you give them cotton candy, right? Have you ever held a kid's hand that just had some candy and
Oh,
it's so
forget it.
sticky that it
Very.
transfers to you? So think of that if I flipped that into my body and I now have sugar sticking to all of the proteins throughout my body. And the more I bombard um, my body with this sticky substance, my body becomes very inflamed And with the diabetic, that glycation, that's what it's called when the sugar molecule sticks to the protein receptor, the advanced glycation implant. Well, I want to tell you rage and age and all that stuff. But when it sticks to it, it doesn't let go until that cell has lived out its normal life.
That's right.
And the ability for Joshua to have that glycation much more reduced than what Rachel went through. We have a whole generation of type 1s that we can allow to have a very normal life if we understand it, if we understand what it does. But I will tell you one story about Rachel. So all these years, so I've been doing low carb 8 years. She's 42. So she was like 34, if I'm doing the math on a Saturday morning, right? I don't know when this will air, but he made me get up and put on makeup at 8 a.m. on a Saturday. Thank you, Dr. Ham. Anyway, so she had been seeing the ophthalmologist for her retinopathy checks. Retinopathy, ladies and gentlemen, is where the tiny vessels in the back of your retina, that sticky sugar starts to change and inflame those blood vessels, and they will not allow enough oxygen in and waste product removal over time, and part of the retina dies. And therefore, your vision is impacted. And Rachel had some very, very early retinopathy that had been developing, but not severe for as long as she'd been type 1. She starts low carb. She goes back for her annual, same lady, same ophthalmologist, and she does the little thing, and she's got the little, and she's looking, and she sort of jerks back, and she looks down at Rachel's chart because they take little pictures of the vessels in the retina, and to check for progression. And she goes back, and she jerks back, and she looks at the chart, and she looks at Rachel. She goes, "You are Rachel Thomas." And she goes, "Yes." And she goes, "Okay, I've got the right chart." She goes, "You've had some reversal of that retinopathy that we had mentioned last year." She said, I just don't see this. Never. And she said, "Are you on a different medication?" She started really like intensively questioning Rachel. And Rachel's like, "Well, I have stripped out almost all sugars. I've gone low carb,
Mm-hmm.
and I've been able to drop my insulin significantly," which meant she
Mm-hmm.
lost weight, of course.
That's right.
And that it's going to make me cry. The ophthalmologist burst into tears,
Wow.
gulping sobs. And Rachel's like, uh, like concerned that she'd said something offensive. And the lady and she goes, "My daughter was just diagnosed 3 months ago with type 1. And she says, because I see people go blind, all I
Right.
could project was this was my daughter's future."
That's right.
And she goes, "You've given me hope."
Wow.
So
Wow.
can you imagine what and so it cascades because our blood vessels are so impacted.
Right. All over your body, not just in your eyes, in
Right.
your
Yeah.
kidneys,
So,
in your
well, this is why,
extremities.
right, because I deal in wound care, I see the diabetic changes in the foot.
That's right.
And I see the hemoglobin A1C of 13, and they've got this chronic ulceration, and then the whole arch of the foot collapses because the blood flow to the bone itself weakens it. And the lack of feeling because the blood vessels to the nerves are impacted. And to think that we could, in some way, reverse, more importantly, prevent. It's never too late. There's
That's
always
right.
hope.
Never too late.
It's never too late. It is. I never thought at 67 I'd be popping around the dance floor 2 solid hours,
And
Dr.
you sure were.
Ham.
And guess what? Your eyes provide a direct view of your blood vessels.
Yes,
Probably
it
the only
does.
place where you can see the blood
I
vessels.
hadn't
So
thought of that. That's true.
it's like right there. So and with the equipment the eye doctors have, they can see it. It's like going to the Discovery Channel. They can see it very well. And I'm going to tell you something. It is so refreshing that, and unfortunately, it took a doctor with a personal experience. And that's kind of what's wrong with us now, is that
Mm-hmm.
sometimes we have to have a personal experience.
Mm-hmm.
But she did in that moment realize, a patient taught a doctor something and provided hope to a doctor who now, and my hope is that as she educates her daughter and provides that guidance that she'll
Yes.
then realize I need to do this for my patients too, and now provide more complete eye care,
Yes.
more preventive eye
Yes.
care,
Beyond
and
just look right.
beyond just treatment. And so I really appreciate that. The other thing I appreciate about your comments is the cotton candy, and that's why I want people to go to Ask Nurse Cindy's YouTube channel, because you're very good at giving a visual example that's easy to understand, and I really appreciate that. And so we're walking into the 11th floor. What was it? I can't think of the name of the
Oh,
restaurant.
the
I should know it.
Windjammer. The Windjammer.
Windjammer, exactly. We walk into
Which
the
is a
Windjammer.
statement to I still love food if I remember the name of the buffet.
You definitely still love food, and we ate well. And the very nice hosts are there. We have to wash our hands, not just with
Washy
the
washy.
sweet. Yeah, you have to really well wash it. They would say they're very nice. I really
Oh yeah,
appreciate
it's
their.
great. Yeah.
But in on a couple of those days, and it may have been with dinner, to the left you would see this cotton candy
Oh,
machine,
it broke
right?
my heart.
It broke my heart. Now again, for those who've never done a low carb cruise, it's really a cruise where we are low carbers on a normal cruise. So the
And we're a
food is
subset.
the same, right? We're just a subset. So, and so you, and this is what was funny. I talked to Maria Emmerich, who was also a speaker
Mhm.
with her two
Mhm.
beautiful young men.
Yes, yes.
And she said one of them looked over at that machine and was like, "What is that?"
That's great. They didn't
They
even
didn't even
know,
know what a
right?
cotton candy machine or candy was, and imagine living in a world where our babies don't even know what that is. So I appreciate that example of the stickiness, and you're so right. It sticks to everything, and we have blood vessels everywhere, and
Yes.
we have
Everywhere.
nerves everywhere, and that
Yes.
glycation, that stickiness to our cells and our protein and our fat will destroy your entire body. So when you fix diabetes, you fix your risk for dementia, you fix your risk
Yes.
for blood pressure, you fix your risk for cancer, you fix your risk for
Yes.
all of these conditions that are
Yes.
related to inflammation,
Incredible.
insulin resistance. So if you've never heard that message before, if you're watching or hearing us today, you need to do that experiment at least for 90 days, and you'll see
Yes.
things improve you hadn't expected. Your migraines go away.
Yes.
Your stomach that used to irritate you go away. Your
Yes.
skin starts to clear up. So guys, I wish I know it sounds like it's a hammer, a keto hammer, but it works. One more other thing I want to mention before I ask you about your family, and I want to hear stories of healing from your family beyond your daughter. Diabetic ketoacidosis is not nutritional
No.
acid. There's no when you eat a keto diet and you go into ketosis, that's nutritional ketosis. That is not the same as diabetic
Absolutely.
ketoacidosis. When
Right.
you get diabetic ketoacidosis, it's more of when your body doesn't have enough insulin to get the blood sugar into your cells. The body's like, I need energy from somewhere. You start to break down fat into ketones. And when you get
Mhm.
too much ketones too
Mhm.
quickly from lack of insulin, that can then make you acidic, and when
Yes.
that occurs, you can get acidosis, which can be life-threatening. You end up in the ICU looking at Cindy and her team,
Yes.
and
Mhm.
that's what we don't want. So nutritional ketosis is not the same as
Totally different.
diabetic ketoacidosis. The only time you are at risk, and I shouldn't say only, but the time we should think about is when you take these medicines like Jardiance, which make you then, urinate out the sugar instead of
Yes.
not eat it.
Right.
And in that setting, on in a keto diet, you're at risk for what they call euglycemic acidosis.
Oh,
But
wow.
again, it's because you're taking a medicine you probably shouldn't be taking in the first place. So I'm not suggesting anybody checking us out don't take your Jardiance and those medicines. I'm just saying it
Yes.
would be
Yes.
better for you not to eat the poison, and then you won't have to
Yes.
worry about peeing out the sugar. So I just wanted to say, but let's go to your family, because you love your family,
Yes.
and I want to hear a little bit about the success other family members have had. I know there was a lot of, I think you
Yeah.
mentioned during your talk or in a side conversation, a whole lot of pounds were lost. Tell me a little bit about their journey.
So, my sister Debbie, the one that's passed away, is the one that introduced me, or I felt that she was hounding me to stop
Mhm.
eating sugar, because she'd found low carb through Dr. Eric Westman and some others, and was really starting to see some weight loss. My entire family has been morbidly obese. I mean,
Mhm.
and so there's that, well, it's genetics, it's my whole family's fat. I wonder, there's probably some glimmer of truth there, but I think in my family at least, it's because of how we responded to food, how we treated food, how we rejoiced and mourned and just dealt with boredom with food and the type of
Mhm.
food we ate. So I think that familial relationship with food is a lot of it. So Debbie contacted me, and every time, over and over again, and it
Right.
was driving me crazy, ticking me off. And so I would say, "Oh, I just got a work call. Oh, something, I got to go. Oh, I've left the burner on," and I would cut her off. And she was wise enough to step back, because
Mhm.
anytime you try to force anything down someone's throat, even your dogs, they will gag, right?
Mhm.
Because you are forcing it versus letting them chew it, digest it, and swallow it. And so she sent me a video link. It was Dr. Sarah Hallberg. It's her TED Talk. She's in blue
Gotcha.
pants, and it's what if we've been treating type 2 diabetics all wrong? And my hemoglobin A1C was 6.4. I was 240 pounds. So I was, based on the guidelines, a tenth of a percent away from being type 2, but I was really already, we know this now. But anyway, so she said, would you just watch this? It's about 15 minutes. Call me if you want afterwards.
Mm.
And I was so relieved she wasn't going to mess with me anymore about it, because I didn't want to give up my fill in the blank, my sugar, my candy, my chips, I was truly addicted to that cycle
Yeah.
of up and down. So I begrudgingly watched the video, because after that she wasn't going to mess with me anymore. And I sat there and I was riveted. It was like all the little pieces, with Rachel being type 1 and with my all the different things I do in wound care. I was like, you've got to be kidding me.
Yeah.
You've got to be kidding me. So much guilt and shame from my inability to be normal fell away. And I was like, I have been misinformed. I won't outright say I've been lied to, but I've been severely, as most of America has been, and now globally, misinformed as to what it takes to live a healthy life. You notice I didn't say to lose weight, to live a healthy life, one of vigor and excitement and purpose, and even being able to sleep well. I didn't sleep well at all. Anyway, I called her back, and she was surprised. I called her back like in 20 minutes. And she goes, "Hello?" I'm like, I said, "Oh my God, Debbie. Oh my God." And she's like, "Right?" And so she and I began that journey. And her husband was resistant. Mine was adamantly opposed to. He had just had a cardiac stent put in a year prior, and was into the chicken breast, boneless, skinless, from Costco, that you then picked
Of
off
course.
every available, lots of quinoa with lots of blueberries. I mean, and I looked at him. I said, "But I've tried everything else, and I just keep getting heavier and heavier again every year." And he's like, "All right, give it a shot." And I used a lot of keto sweets and treats at first.
Of course. Of
The
course.
big thing was I was avoiding my addictive foods. I was
That's
subbing it
right.
out. And I said to Debbie, I said, "You know what? I don't care if I eat an entire Costco chicken one day. I can't go back to carbs." Because once I got into ketosis, osis is just the state of halitosis. I have bad breath.
Mm.
Ketosis, I'm using ketones, versus ketoacidosis, I'm
Right.
acidotic. There's a huge difference. But once I went into ketosis, it was, Dr. Hampton, you would die laughing. I was like, oh, oh my word, I feel amazing.
Yes.
I had energy. I was, here was the funniest thing is I realized one day I wasn't thinking about food every moment. But I didn't realize I wasn't thinking about it till I realized I hadn't thought about it. Weird. It was so weird, right?
That's
And I
right.
walked into the kitchen one day and I went, "Did I come in and eat breakfast today?" And it's like noon. And he's like, "No, you haven't been in the kitchen." I'm like, "Ah."
Mm.
Amazing. So anyway, so she and I started following that, and Clarence is
Mm.
still over there eating his quinoa. He's picking off the chicken breast, and I'm crunching up pork rinds and frying chicken in lard, which is amazing, by the way. And he said, "Well, okay, I can see that you're losing some weight, and you seem to be pretty excited still. It'd been 2 weeks. Always by then I was done." He goes, "I guess that's all right, but there'll never be bacon in this house."
Oh, wow.
I don't know about you and marriage, but I choose my battles. I travel a lot for my job, or at least I did back then before COVID. And I thought through my what would be a non-inflammatory response. Because there's an event, you'll never have bacon in this house. My
Right.
response was going to determine the outcome.
That's right.
Meaning, were we going to fight the rest of the day? And I looked at him and I said, all right, because I knew I could get bacon on the road everywhere.
Right. You're funny.
So anyway, so as my sister and I became more and more committed and excited, we went to our very first low carb conference. And
Mm.
my daughter Rachel, because I'd been talking to her and Justin about it, because they were both struggling with some weight issues and her type 1. And the way I got them to the conference is I looked at her husband. I said, "You can have bacon cheeseburgers and steak with,"
Mm.
and he was like, "Oh."
Oh my God.
So we sat, and one of the first people I heard speak was Dr. Dominic D'Agostino, who was on the cruise with
Mhm.
us. And the way he was explaining the work he's doing with the Navy SEALs and what
Right.
ketones as your fuel source do, um, with them, it's related to not having
Mm.
oxygen toxicity seizures underwater.
Right.
But anyway, and others were Dr. David Diamond got up and spoke, and a lot of
That's right.
others, and all the pieces that had fallen into place with Dr. Sarah Hallberg's.
That's
I was
right.
just getting bombarded with. I had fireworks going off in my
Yeah.
brain
Oh, man.
about that's what I've been doing to myself. And I looked down the row at my family sitting there with me, and I said, I can never eat ultra processed foods again.
Mhm.
I didn't know at the time that's called a single decision. And in addiction recovery, when you make that single decision, I will never drink alcohol again. I will
That's
never,
right. That's right.
whatever the addiction is. That allows you then to not have to keep making decisions about birthdays or holidays. Ooh,
Mhm.
will I, you know? And that was 8 years ago. So for a long period of time, one by one, the family members started joining in. And I
Yeah.
think the maximum we lost when I added it all up was like 1,200 pounds.
1,200.
1,200 pounds as a family. Now, unfortunately,
Mm.
the single decision was not made by all of them.
Right.
And there are some that have gone back. And as
That's
we
fair.
know, when you have had a relationship with carbs and you're away and then you go back, it
That's
seems,
right.
and there's probably a medical reason that I don't understand well, that the weight seems to come on very, very quickly.
Yeah.
I mean,
Yeah.
very quickly.
Yeah.
So some of them are still struggling, but the knowledge is there. And I'm not going to jam anything down anybody's throat. What's
No,
hilarious
never.
is when I do sit down with people at work, when we're back together in the cafeteria, especially before COVID, and I'd sit down with my meat, and because I'm an inadvertent carnivore most days, just over time,
Yeah.
my palate has changed, and I always go
That's
for the
right.
protein first. But anyway,
Yep.
I would sit the plate my tray down, and they'd look at what I had, and they'd look at theirs, and they'd start justifying it. I don't normally eat this. I just got this just, and I'm like, I'm not your mom, and I'm not the food
Mhm.
police, but this is what's,
That's right.
because they've all seen that. I was in a town hall meeting just the other day with a new senior leader that joined the company, and so many people came up to me and they're like, "You're even smaller than you were when I saw you a couple of years ago." So the family has done well.
That's right.
However, if you go back and start eating cotton candy again, your whole body gets sticky again.
Yeah, it gets sticky.
But my dad's 92, Dr. Hampton. He's a hoot. That
Right.
man is living his best life because he's now 8 years low carb. And he is in a senior apartment, not assisted living, but he's like, here's how I explain it. He is in a geriatric co-ed dorm.
That's what it is.
He's got community,
That's right.
he's got purpose. He helps people, and we talk about it quite frequently that a lot of his ability to maintain his mental alertness is because his brain's not inflamed.
That's it.
from all the sticky sugar.
It's Dr. Georgia E. Thank God for her and her
Yes.
book, Change Your Diet, Change Your Mind or Brain, whichever. If you don't have that book, guys, get it. And yes, you can have mental clarity. You can reverse early stages of dementia. It's called type 3 diabetes for a reason. So, for those who are afraid of that diagnosis, I am so
Yeah.
grateful that your dad is thriving. And thank God your husband was able to have a little Scooby Doo moment when he did that
Oh,
Scooby Doo sound. But I
yeah.
also want to mention Dr. Sarah Holberg again.
Oh,
We Nina Teichol's put together a legacy course, and in the notes to this podcast, video, and or audio, we'll have a link to that free
yeah. Wow.
uh, course with people like other guests, including I was on there, Dr. Ben Bickman's on there,
Wow.
and we share the healing potential for
Yes.
type 2s. We can manage type 1 extremely well and have a long life, and we can reverse type 2. And the course talks about how that's possible. So I want to make sure
Oh,
people are aware. And
that's
of
so
course, that
good.
TED talk. In fact, I have the talk at it's called the DOLL Symposium, Diabetes Symposium for Advocate Health, which is on my hat. And I am going to share a 2-minute clip of Dr.
Oh,
Sarah
great.
Holberg's. And it's the part of the clip that deals with the story of a person who had gotten off insulin, had been on like probably 200 units and got off all of that insulin within weeks doing a keto diet. So we know this works,
Mm-hmm.
and to convince me otherwise when I see it in clinic and in the
Yes.
studies would not work. And if you show me something else that works, that'll be fine. But clearly, keto is one of the things that works. So
Yes. Yes.
so real quick, I want to just we have I'm a carnivore 98% of the time.
Mm-hmm.
And if you eat a vegetable, I don't think it's gonna, kill me if I eat a
Right.
vegetable.
Right.
Shout out to Dr. Anthony Chafee.
Yes. Yes.
So I do think you can indulge when you tolerate these things.
Mm.
There are certain things I don't tolerate.
Right.
So, but I do want to say this: their carbs are hidden,
Oh.
and if you could just speak a little bit about what people need to think about, so they'll understand,
Mm-hmm.
things they need to be mindful of, so that if
Yes.
they have things to worry about, type 1 diabetes, et cetera, they'll know what to think
Mhm.
about.
Yes. It is interesting that the food industry has an entire body of science behind it that
Mhm,
is meant to have foods last a long time, be very inexpensive to produce, and be very savory or salty or
mhm.
sweet or heaven forbid that trifecta, right?
Right.
And they do that because when you do that as a manufacturer and people get that, bet you can't eat just one, the Lay's potato chip ad.
Guess
Truth.
that right. Truth.
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 I've traveled the world for my job, and before I was low carb, I would get Lay's potato chips or Fritos or something, and they always tasted the same, right? But they have chemists. There are food chemists that calculate flavor, salt, sweet, fat to the point, and they do testing on consumers till they get to the bliss point. And that bliss point is where it's just right. Meaning, I'd like some more, please. And so when we look at how they do that, they can't say on the back of ketchup, half of this bottle is sugar. So they have different names they give it based on the chemical, how they attach the carbons and the hydrogen. And there's at least 98 names that are used in the food industry to hide the word sugar. High fructose corn sugar is one of the worst. Back before Cuba had the big hurricane and was so shut down, there were a lot of sugar plantations down in the Bahamas and the Caribbean. And so they'd grow the sugar cane. And as much as sugar is still a problem, it was sugar. But when the crops got wiped out and farmers had corn, they found that they could manufacture this high fructose corn syrup. Anyway, make a long story short, so there's all sorts of names that are the name. I tell people, if you cannot pronounce the name on that package, it is probably something that you might want to look at limiting. And if
Absolutely.
there's more than 4 or 5 words under ingredients, if the ingredient list is half the back of the bag, be aware that that's what it has taken to make that particular cellophane encased thing as flavorful as it is. So what
Mm.
am I benefiting? Because here's the thing. Remember, we talked about once I swallow it, the body takes over. So
Hmm.
our body is instead of a manufacturing plant, it's a demanufacturing plant. It breaks it down. It doesn't, and it sends it out. And as it breaks open these chemicals and these different types of sugars, I have to believe inside our little sensors and our little, the communication up the brain's going, do you know what this is? No, I don't know what that is. What should we do? Let's just store it. Let's stuff it in the fat cell. So we end up with a very confused body being
Hmm.
bombarded with things that we were never designed to eat. I mean, we can eat them. We were not designed to benefit from them.
Hmm.
And so there's a lot of there's that saying in a certain movie, I think it was about the mafia, that says, "When in doubt, follow the money."
Hmm.
When in doubt, follow the money.
That's right. That's right.
So the hidden sugar is real. The
That's
longer the
right.
list of ingredients is, the better chance it's going to be sugar in there,
That's
or
right.
these things called flavorings.
Hmm.
And those flavorings, I don't know if your audience knows about the FDA's list of GRAS, generally
Hmm.
recognized as safe, which means it hasn't killed anyone quickly. And many of the ingredients found in foods here in the United States are banned in Europe.
I know.
And so that whole thing about hidden sugar, the best food is a food that doesn't have a label. You look at it and you go, oh, that's an avocado. Oh, that's
Right.
a steak. Oh, that's a broccoli. It's a little Brussels
Yeah, it
sprout or a
should
piece.
be, yeah, one ingredient.
Yeah, because then when your body deconstructs it,
Mhm.
demanufactures it, it goes, looky there. I know what that is.
That's right.
I
That's
can
right.
use that to build a strong cell wall, or I can help take those vitamins and minerals out of there. And
That's
I,
right.
I don't eat nearly the fiber I used to. I used to think that was a very important part of my healthy gut. Um, I think a lot of times fiber is basically, I want you to think of wood chips.
That's right.
I want you to think of wood chips, cellulose, right? Wood chips. And I don't think I'd sit and dump barbecue sauce over wood chips and eat it to help
Nope.
avoid constipation.
No, it wouldn't make sense.
And I think of what beavers do. And beavers will chew through the wood. They don't eat it, but they chew through the wood so the tree falls across the creek
Right.
and it builds up. That's fiber, right? That's fiber.
That's right. That's right.
And eventually it'll get to the point that things back up. Let's pretend it's our gut. And now I am really constipated because there's nothing able to move downstream.
That's
So
right. That's
there's
right.
so much that I've learned and continue to learn, and am thrilled to personally experience. And my husband's my biggest supporter now.
Nice.
He's like, you want some butter on that steak, baby? Do you want me to fry you up some bacon?
That's right. That's right. I love it, and I think about Dr. Anthony Chafe again because um, I think he may be right. There are some forms of plants that are trying to kill you. I know for me, all of that fiber, it bloats me, it irritates me, it probably increases my risk for a leaky gut. It's the opposite of what they say it's going to do to help me. So
Mhm.
I don't want it,
No.
and when I do get fiber from when I kind of have a ketovore day, I'll have things that don't historically irritate me, like green beans. I always use that example.
Mhm.
So I'm a big fan, and I think as we're kind of getting close to wrapping up, I think I want to speak a little bit about insulin. I think
Mhm.
insulin
Mhm.
is kind of demonized,
Mhm.
but yet I don't know that we can live without it.
Oh,
So,
no.
any thoughts on when people hear the word insulin? Should they run and hide, or should they? So, what's good and bad and ugly about insulin?
Well, insulin is one of what we call a master hormone. And
Yes.
a hormone is think of it as sort of like a chemical that the body manufactures and releases to cause other reactions to happen.
Yes.
And insulin has a lot of functions in the body, but the one we think about and know, and probably the most important to our health, is that it is designed to help remove glucose, sugar, from the bloodstream and either allow the cells to use it for current needs. It's like
Yeah.
if I flip on the light switch, I need energy to light. So there's certain cellular energy that's required just to keep me sitting up in this chair and looking
That's
at the
right.
camera. However, that being said, when we are constantly bombarding our body, so it has to be insulin. Lack of insulin in my Rachel and my Joshua and your wife will kill you. That's type 1 diabetes. I must have insulin to live. And that's why they go into ketoacidosis, as you mentioned. The glucose gets built up, and then the body starts breaking down the fat stores in order to fuel it. And then we get this acidotic state. So insulin must be present for us to live. But what can happen is when we trigger it too quickly. Have you ever seen kids that you come in and the TV is way up and it's
Mm-hmm.
the volume is much more than it needs to be, but they
Mm-hmm.
become acclimated to that when we
That's
bombard
right.
our body with all this very quickly digested glucose. The insulin is like, okay, okay, I just got back to the house. You want me to go again? It's like when I used to be on call in the OR, right? Oh my God, I got to go again. Okay, okay, I'll be there. And what happens is it becomes resistant
Mm-hmm.
to it. Well, the cells become resistant, is a better way to put it. So the pancreas is just increasing production, and the
Mm-hmm.
cells are like, oh, not again. Okay. And so now the cells are like full. They're like, they can't store anymore. And so they turn their back on the insulin and they're like, can't hear you. It's like when you're kids, right? They're constantly like, mom, mom, mama, mom, like that cartoon, right? Mama, until they're like so blatantly. So insulin production can only go so far. The pancreas cannot just keep increasing the volume because you'll get to
Mm-hmm.
that point on your TV that the volume is as high as it can go. And now your eardrums are damaged. So we are in a delicate balance of trying to eat the right foods and reduce that exhausted pancreas, its need to crank that
Mm-hmm.
up. And then
That's
as
right.
our cells are replenished, because our cells turn over, they live and die, they have a lifespan. Those receptors are like, well, hello, I haven't seen you in 12 hours. I used to see
Right.
you every 30 minutes.
That's right.
Welcome. Come on
Right.
in. And so insulin is good. Too much insulin, not good. Too
That's
little
right.
insulin, like a type 1 diabetic where they've just stopped producing it.
That's right.
So it's a balance board. It's like I'm standing on a seesaw and I want to find for me, for you, for our clients and patients and friends, what's that balance?
That's
And
right.
use whatever bridge you need to get to the point that you're not opening up cellophane all the time.
Nice. I appreciate that. And balance is so important. That's why some of us are eating a certain way and we're not, most of us are not carnivore. Some of us are. It's about balance and it's about understanding what your body needs. And we kind of started this conversation around the theme of happiness, right? So maybe as I'm going to ask you that question about happiness and then how you
Yeah.
plan to protect your nest. So my question is like, just, you know, tell me a little bit about what would you want to leave with the audience in terms of
Mm,
how they can find happiness in their life? What does that look like? I know your definition may not be the same for everybody, but I think it's important that the theme of this episode for me is just how do we achieve happiness and what that should look like. And so what would you share with the audience just to kind of wrap this up?
it's such a really good question. And of course, it will vary, not just
Exactly.
between us, different people, but depending on where we are in our age, where
Oh,
we are in our life cycle, and
no doubt.
what are we facing. Um, Happiness is a choice. I can look at I don't know. I can look at this rock. I'm going to show you this. I can look at this
Yes.
rock and I can say that is just so ugly.
I'm not sure why you got a rock, but
I know. I know. Well, because I tell people I'm really funny.
that's right, 'cause
You may not agree, but I amuse myself.
I
So
should be screenshotting this image and putting it on the thumbnail.
so this is my life, right? And I don't think there's anything good about it. And so therefore I'm depressed and I'm unhappy and
Right.
I feel I compare myself to others who have this amazing life.
Mhm.
But for me, mental attitude, right? To that whole, as you walk down the ship, the cruise ship, there was this big sign. It said, mind your head as you
That's right.
walked in.
That's
And
right.
it meant
That's
about
right.
height, but I thought, I
Wow.
took a picture of it, Dr. Hampton.
That's nice. I like that.
Mind your head,
I
because it
remember
all
seeing
starts
that.
here. You have to
Yes.
have the thought before you take action, and that action will determine
Mm,
your
mm, mm,
day, determine your month, your year, your life. So here's my life. If I feel that I have no hope, which I felt that way in many ways at age 59, and yet when I changed my food, I changed my life. And
mm, mm, mm,
inside, what I this is me.
mm,
These are
mm, mm.
these are amethyst crystals. They were simply buried under the fat, under the despair, under the shame and the
Mhm.
guilt and the lying I did to friends and family and even to myself about what I was eating. And once I saw my value, that
Mm,
if I under once I understood that changing my food changed my life mentally, physically, I could enjoy
mm,
the Cindy that I was
mm,
meant to be. And so I would just encourage people to realize that this is not you.
mm.
It's not.
I
This
love
is you.
that.
And then from there, once you feel healthy in your own body and your mental status is more stable,
Yes.
there's hope.
Man, and that's all we're trying to do today is restore hope, and I really appreciate that message. And again, I'm happy you have that rock crystal looking thing in your home to share an amazing message. And so it's called protecting your nest, and what we're trying to do is remind people that yeah, we're big on low carb, keto, and carnivore, but we also think your exercise is important. We think the
Yes.
stress and sleep is important. We think your thoughts are important. We think recovering from trauma is important. We think your relationships are important. Avoiding things that can harm us, like organisms and pollutants. We think our emotions are important. We think our life experiences are important. So when you think about all of those things, where does Nurse Cindy plan to give a little extra attention over the next 12
Yeah.
months?
What a great question. Um, Self care, for me right now, work is extremely intense, and I've been doing 12 and 14-hour days and then traveling on a weekend to get to a conference. So that is a boundary thing that I need to be, because every company's like, we want work life balance, so that could be a
Right.
challenge, especially
Yeah.
when you really want to make a difference. And I know that if
Mm.
I am educating, I am helping patients. So
Mm.
setting some sort of limit on the hours, even if I don't get everything done, that's number one. And number two, I had some surgery back at the end of November that limited my ability to lift heavier things because I was training for a strength training competition,
Okay.
strength powerlifting, sorry, not strength training, powerlifting competition. But the surgery I need to get back with my trainer, and
Mhm.
I want to lift heavy things. It's very objective. I can do this many reps because I was squatting like 140 pounds and my deadlift was pretty good. But anyway, so I think the exercise will come as a
Mhm.
back to what I was really enjoying, will come as a result of putting some limits on my work.
Well, let me tell you, I shared with you that I had a patient who I will see today in a bodybuilding contest.
So
Now,
awesome.
you won't have to worry that that hasn't been a focus because he
Mhm.
only started, and I'll say his name, Kevin Rouse, and his wonderful wife, Jackie. Um, it was in November, which is only, what,
Yeah, 6 months,
eight,
7,
6, 8,
yeah.
yeah, 7, 8
Mhm.
months ago. Listen, he's in a contest as a 61, 62 year old. So it's never too late. Just
Never
I
too
think
late.
about your dad. And it's important that we heal. And I just pulled up I shared this with my family. You may have heard, I was exhausted. Boston nurse dries off top floor of hospital garage after shift. And it wasn't intentional. You think
She
it
just
wasn't suicide. She just fell asleep and and she survived, but we
changed.
are overworking people, particularly in healthcare and particularly nurses who do 12-hour shifts. And if you work a 12-hour shift, guys, you need an hour to kind of get there, an hour
Yes.
to, you're looking at 14 hours of your
Yes.
life that are just consumed with delivering the gift of healthcare to people. And so we really want to make sure our clinicians are cared for, but it kind of starts with themselves caring for themselves, because the system is, we're just cogs in a wheel. So
Yes. Yep.
we got to get the ICU staffed and ran, and there are going to be some collateral damage of that. And sometimes it's you when your teammate
Yep.
doesn't show up and you're doing
Yep.
a double shift or whatever. These things happen. So, but do self-care.
Yes.
Learn one of the best words ever invented was the word no. Sometimes you got to say no, and we'll go from there.
Yep.
So,
Yep.
but I do want to wrap up with you sharing how people can reach you. We know we got a phenomenal YouTube channel. I hope
Yes.
to come to that channel myself one day, but how can people reach you?
Um, I'm a really simple person. I'm not ask ask Nurse Cindy, because
Right.
I like to answer questions. It's what I do for a living with wound care. People ask me questions. So AskNurseCindy,
That's
FaceTube,
it.
FaceTube, FaceTube. I've just made a new social media platform, FaceTube.
You can okay.
That's Facebook and YouTube put together,
That is
FaceTube.
so funny. My wife calls Facebook face page, so she's not big on social media
Oh
as
my
well.
word.
I
So
wasn't.
they
I
can
didn't
look at
do it at
my
all.
they can look at my journey through time, and
Yeah,
things like
that'd
this
be
are
cool.
really motivating me to get back out and share my story a little more
I
frequently than I
I
have.
appreciate. Yeah, it's always good to get on other platforms. So thank you again for how you connected with my wife, how you forced us to the dance floor, how you
Forced.
kind of, and literally when I got on that bus going to the hotel,
Yeah.
it was, I think we kind of was like, hey, and my wife was like, do you guys know about me? My, she's
She
advocating for
was
me.
great.
She didn't mess around. She's a true advocate, and she loves her husband. I love
Yes.
her. So it's
Yes.
all, do a shout out to your husband for giving us some time on a Saturday morning.
You
And
always he's fine. Yep. I smell bacon frying, so he's
oh,
getting his.
amen. So amen. So I'm glad he's been converted. So thank you so much as we wrap up, and I'll say a few closing comments. All right. So, guys, I enjoyed this interview. I hope you did. And I looked up the definition of happiness. It said it's the opposite of sadness. That's a pretty easy definition. Happiness is a sense of well being, joy, or contentment. When people are successful or safe or lucky, they feel happy. And I would argue that feeling healthy, and more importantly, or just as importantly, helping those around you feel healthy is a great way to achieve happiness as well. So, hopefully, after hearing Nurse Cindy's story, you will be happier and motivated to be as happy as possible and spread some of that love and happiness to
Yes.
those around you, like Nurse Cindy does. So, you make sure to share this episode with anybody who needs to be lifted up. And as Nurse Cindy said, as we were wrapping up, mind your head. Make sure you protect your brain from self-limiting beliefs, negative thoughts, and no matter what you've been through, I promise you, tomorrow will look greater. And I'm really looking forward to all of us evolving, getting better, and just getting closer to our ideal state. We don't have to get there, but we should always be striving to get there. So I appreciate everyone who joined us on today's episode of the Protecting Your Nest podcast. And until the next episode, continue to be safe, be well, and continue to protect your nest.